Hey guys, happy Monday after Easter morning. Hope you guys are safe. If you're here in the southeast anywhere, you might have spent last night a little concerned, a little nervous, a little worried. You know, it was interesting. I was just talking to Kristen here at the front desk. We were talking a little bit about this. I said, you know, it's funny. A tornado is a lot like a virus. You see it, right? You don't see it personally, but you see it in the news, you see the signs of it coming, you see the storm, you see all these things, and then you prepare for it, right? And then you kind of lock yourself down because there's a storm coming, it's a tornado coming. And even though we all know that the percentage, the likelihood of us ever getting a tornado, to end up taking away our homes or, potentially the worst case scenario, our lives, is very, very, very slim. But of course, it's a real concern. And so with that real concern, we lock down. Well, it's interesting. Some people don't. They stay in their beds because they know, it's a very low percentage. And so they're not worried about it. They don't go under the stairs. They don't go in the basement. They're like, well, it's getting close. Maybe I'll wake up and I'll see what the path appears to be. These days we get so much more information, so we get to kind of make a decision on that. But in the end, because it's not as much of a risk, I don't know that we necessarily take it extremely serious. Now, some people do. Some people have just great fear of that. And so what happens is when you sprinkle emotion on top of the reality, then the fear goes bigger than the risk, right? It becomes a bigger deal. But then it's kind of like, well, what's the risk reward? I mean, there's not a whole lot of effort for me to go and hide out in a basement. Well, actually, I moved. I don't have a basement anymore. So that was our first storm without a basement. Kind of weird. But we would, potentially go in the basement if that was the case, if we had the basement. So instead, the kids were under the stairs. We're just in the tightest spot of the house. So it's kind of like, okay, well, yeah, it was worth it, I guess. Why? Because it wasn't that big of a deal to us to do it, right? That whole idea that the cure is definitely not as bad as the disease in the case of a tornado. But we go under the stairs, we lock down, and we do it for a window of time, right? There's this little window of time, it passes by, great, life is normal, here we go. And that's obviously where these two things go completely different directions, and the train is derailed in the viral world because here we are, right? So I wanted to talk, so I promised I was going to kind of have this conversation back and forth between someone who's really all over the idea that we need to stay in, hashtag stay in, shut it down, socially responsible, social distance, you're irresponsible to do anything but that, et cetera, et cetera, et cetera, which I'm still going to continue to argue that that's wrong, that there should be some movement in the world, that the economy is actually pretty valuable to the health of people, even almost as much as what this virus is in the opposite side. So it's an interesting perspective, I know, and it sounds insensitive for sure, but I'm going to talk to that sensitivity here in a second. So first though, you guys, I want to make sure you've noticed, it's out there. I'll go ahead and post it in the comments here as well. But just to show kind of the aggressive drop-off of influenza. And so this has been a kind of a big conversation. I just watched a video last night of a medical doctor out in Montana, I believe, is where she was from, and she's talking about death certificates. And kind of the point of the death certificate is to give the best guess as to what the actual cause of death was. And so right now in our country, and I can see how this would be done because nobody wants to miss any coronavirus deaths, right? So on the side of public health officials, we don't want to miss those. We don't want to let coronavirus deaths or COVID-19 deaths go without being caught, without being captured and put down, in some way, shape, or form so we can add it to the data. But in so doing, we're skewing the data even further. So I've said from the very beginning, the lack of testing will continue to make the fatality rate higher than it really is. It's purely the truth of all epidemics. Again, I've been paying attention to these for the last 20 years, heavily, high level of watching and consideration and data analysis for the last 15 years. So we go back, and we got SARS, MERS, we got Zika, We've got H1N1, right, which is a swine flu variant, avian flu. So we got all these different flus, influenzas. And so I just recently commented to somebody, I said, I don't know if this is actually different than seasonal flu or not right now. I'm not too sure. And I know that sounds to some people like, what are you, crazy? Do you see how bad people are getting and how quickly they're dying and how horrible it is and they're all getting put on ventilators? And I would say, I think actually we've seen enough research now suggesting that the ventilator isn't doing enough to say that maybe we shouldn't be using the ventilator as often as we are. And actually, maybe in the medical community, the fear is so high because of what people look like to them and because of what we've pressed into them about the virulence of this virus, that they're moving to a ventilator faster than they should. I know I wouldn't necessarily want one. Until it was like, he's about to die, okay. Because A, it doesn't seem like they're doing that great of a job with people, and B, there are negative side effects. And so I just think there's probably, again, emotion, just so you guys get it, for the ones who are watching this and angry at me, I hope you get, when you sprinkle emotion into data, it doesn't work. Like you can no longer analyze with clarity. Now your analysis becomes clouded with the judgment of fear, maybe not for yourself, but for other people. So the emotion creates that. Now we are emotional people, so I get it. We got to have some emotion, and we want to make a decision because a life is more important than a dollar. Like, if you ask the small business people who are so upset right now because their lives are falling apart, and I'll tell you, if you've never been a small business owner, you really don't have a position to judge them. Because you're like, well, they should have more money saved. They should be ready for the rainy day. They should be, like, you know what? These people, they pursue something out of passion, which you enjoy because you love it when it's there for you. Yet you take for granted what they've put at risk for it to exist. And so I would say, you know what? You really should think differently about protecting them and what does it take? Like, you should say, basically, if you're fine and dandy, then you should go ahead and you should give away half your savings to save them. Like, literally, that's what you should be thinking, if that's how you feel about those people. Now, I'm fortunate. I'm in a business that's considered essential. My practice is essential, but then also my construction business is considered essential. So we're still building, and we're still moving. Which to me, it's like, man, that's unfair almost. It really is. I think it's unfair. So let me go back and backslide over to where I was trying to head with this thing. So the point that I wanted to make about the numbers and the H1N1 and is this the same and is this different and where are we and death certificate consideration is that right now, to be called a coronavirus case, you have to have a positive coronavirus test. So the test has to be shown positive for the coronavirus in order to be considered a case. But on the flip side, if you die, so if someone comes into the hospital and dies, then they don't have to have a positive test. It has to simply be within great speculation. I believe that it was coronavirus. Or they were positive coronavirus, but there were multiple other comorbidities. But I'm going to say, well, obviously coronavirus is in the world right now. It must have been coronavirus. Even though if we consider how many people would be dying every single day from heart disease, which will be considered their comorbidity and their cause of death will be coronavirus. It's like, well, yeah, I think we're probably skewing these numbers dramatically. And so if you hadn't seen the graphic that shows that we've pretty much cured influenza at this point, so the CDC keeps their charts based upon the week of the year. And so what you'll see is if you look back to 2019, there's always some amount of distribution happening, right? So the graph is coming in, and then it peaks up in October, and it really ramps way up. And influenza B is the most significant at first, but then A takes it over, and then A is coming, and then it drops off a cliff edge in about a 4-week period where it goes to like 0. Which isn't actually how it works. So if you look, annually, the deaths do decline as we head to this time of year, typically, and you'll see they ramp down, but then they tail off which is still a pretty significant number. So if you're talking like 50,000 deaths over the course of the year, you're still looking at somewhere around 1,000 deaths a month at this point in time would be typical. Actually, more than that at this point in time. But just pretty much all year long, about 1,000 deaths a month. So, we take all those out of it. I mean, is that significant? If we're at 20,000 deaths, it might not be that significant, right? So just to give you a sense of where we are right now, 16,697, that was yesterday's total. I ran numbers yesterday. And that's, I'm going to kind of move to that now, just to give you just that idea then of like what is the difference between social distancing and not social distancing, and how does that really work? Now, I would say there's no reason to think that anyone should be less concerned about putting their hands in their face or their mouth. I mean, that's something that you should be concerned about all the time. If you don't want to catch flu or something else, you should always have this pretty good stance on universal precautions. And of course, your kids are going to become filled with germs. If you're someone who believes that we were created, then you will understand that that would obviously be God's plan, that He planned for kids to gain their immune system through that process. And that's why most illnesses do not have too severe of an impact on kids. Flu tends to kill more older adults, but it does kill kids. Obviously, this one, these coronaviruses tend to be more older adults, less children. So just looking at the 10th, so a couple days ago, 3 days ago, the percentage of the population in Sweden that had been impacted was 0.1% at that point, so they're kind of behind some other countries. 0.17% USA as of excuse me, let me go. That was just yesterday. 0.14% USA, 0.24% Italy, 0.10% for UK, 0.28% for Switzerland, and then China. We don't really have a clue because we don't trust their numbers. And then we go to yesterday, and we went up about 0.03% up to 0.17%. Italy's up to 0.26% from 0.24%. UK is up 0.12% from 0.10%. So it's it's still growing at a mild clip. So the question then is that, so if 0.1% of the population is infected, or 0.17% of the population, so first off, if you didn't social distance, what would that be right now? And would the hospitals be overwhelmed? Because that's, of course, the line that you're being fed. Would New York be overwhelmed? Maybe. There is the potential for redeployment, and that was pretty obvious because they put up these makeshift hospitals very quickly. Ventilators have been produced in huge numbers, which again, I'm not necessarily a fan of such idea. I know we need them, but I think they're being overused. So, the question is, if it was 5 times as many people were ill right now, right? If it was 5 times as many, and you're at 0.85% of our population, the number will look huge. It'll absolutely look huge. I mean, right now, USA, 560,000. So if we said it's like, oh, we've hit 3.5 million. Now we're at 10% of the population, let's say, 331 million, so we're at 1% of the population, 3.3 million, 1% of the population, right? 1%. The number 3.3 million sounds so horrible. It's like 1%. The point is, I'm just going to say this to the end of the time, we shouldn't be shutting our economy down for this. We should be doing what I said from day one, which is we should be sheltering those people who are high risk. And if you consider yourself high risk, then you should be sheltering yourself. And tell me right now that you wouldn't get a free pass from your job. I'm high risk. Okay, you're fine. But even if you didn't, so if you had a job where they said, well, you come to work or you're fired, why would your situation matter more than all those people have been fired? I mean, so many people have lost their jobs already. So I kind of, that's what led me to this conversation with my wife the other day. I said, hey, be somebody who thinks I'm stupid for what I'm saying. And so I said, hey, I think we should probably change. We should go out in the economy and we should actually start moving people around again. And she said, you're insensitive. And I said, okay, so I'm insensitive. What am I insensitive to? You're insensitive to the people who are at risk. I'm like, okay, well, I think we should keep those people who are at risk. And based upon their own personal assumption, we should keep them sheltered. We should, well, wait a second. I don't know if I'm at risk. I might be at risk. I'm not too sure if I'm at risk. Okay, so then your personal assumption is you're at risk. So then you should stay put. Well, but I don't know that I'm not. I mean, I don't know. What if I'm not at risk? Well, if you're not at risk, then wouldn't you be safer if you just stayed home? So you can just stay home. If you're not sure, you should just stay home. Okay, well, but that's insensitive to me. Wait a second, why is it insensitive? I didn't make you come out into the world. I did what you wanted. I protected you. So yeah, but then you're out. I'm like, yeah, but why would me being out have an impact on you? I'm not sure. Is there anything about the economy that you would like to be open when you're comfortable coming back out? Is there anything you'd like to come back to? Yeah, there are. But that's not the point. Well, that's kind of the point. Because if I'm willing to take the personal risk for myself to ensure for you that when you come out, it's there, then is it not that I'm actually helping your life more than hurting it? Well, but that's not right, because what if you get someone infected who then comes in contact with me? Well, who's coming in contact with you? I don't understand where you lost control here. I mean, if you have control, you have control. If you want to go out into the world with a mask on to go shopping, you can. If you don't want to go into the world, you can have your groceries delivered to you. You don't have to do anything. You can have your groceries be set out on your front porch if you felt like you had to stay away from them. You could handle those with a fresh pair of gloves, and you could clean those. And never would those gloves touch your face, especially if you're wearing a mask. This isn't World War Z where someone's biting you, right? Or like Outbreak where if you come within 10 feet of someone, you get sick. And I know some people think that's the case. You realize that still right now that the likelihood of infection being passed among family members in the same household with a quarantined positive test patient is 10% for the others? It's 10%. It's not like 120%. It's 10. So okay, so back over. So I'm talking with my wife. I'm like, hey, keep going. I just want to I want to test this. I want to figure out where I'm being insensitive to this idea. And she said, well, but so you've got people that are high risk, like my family. Like, what if you open up schools and my kids go to school? Like, okay, so could you not continue to homeschool them? I mean, that's actually a valid answer right there. In Georgia, I don't know about other states, but in Georgia, you have free online homeschool available from the Georgia State Public, education system. So why would you not just keep your kids at home? Well, they're going to feel bad. Like, okay, I get that. So now you're telling me that if I go into the world and I'm moving around, even though I'm not necessarily impacting anyone negatively, physically, because they see me moving and they feel bad, now I'm the person who's at fault because I'm negatively impacting their psyche, not their physical health. Because I want to tell you the truth right now to the person who would say, stay indoors. I would say, you know that herd immunity is something that you will have the benefit of. And if I'm willing to risk myself to go in contact with people, and if they're willing to risk themselves to be in contact with me, I mean, right now I'm going out and doing whatever I can, and I'm being highly protective and avoiding people, and I'm just doing it for their sake, not mine. I'm willing to take that risk because I don't think we'll ever get out of this the way we need to without taking that risk. And to vaccine, this isn't my anti-vax talk, but I'm going to tell you, if you haven't paid attention to what they found previously from trying to create coronavirus vaccines for other coronavirus, you should take a look. Look up the Baylor University guy giving his testimony on this. I think it's fabulous. It's been pretty negative. They've yet to come up with a good solution for a coronavirus vaccine that doesn't have negative impact, creating over-responsive immune systems when they actually do, in fact, come in contact with the virus they're supposed to be immune to. Over-responsiveness, which is a lot like what the problem is for people who are dying right now, which actually makes me wonder if there is some component of the flu vaccine that perhaps these people have had in the past that makes them over-responsive to a coronavirus. This isn't about the anti-vax talk right now, so I'm going to stop it right there. So we keep coming back around to this, okay, well then, all right, you want to stay indoors and you want me to stay indoors. And I'm socially irresponsible because of the health care worker. So I'm telling you right now that to continue to hide behind that is wrong. So 140,000 hospital beds needed in New York City was the initial. Now, right now they'll tell you that that was without social distancing considerations, and I'm telling you that that was this is our best case scenario. That's what they said. They were considering social distancing working and being in place. They said 140,000 hospital beds will be needed by the end of this past week. That's what they said. So that was wrong. They updated that analysis when we got a little further to the social distancing. The model was changed, and it was pushed down to 70,000. And then in total, it was 18,500 that were in use, which is still a lot. I'm not trying to tell you that this isn't a big deal. Is it as big of a deal as they say it is? Is it really that much bigger in total numbers than seasonal flu? I don't know that yet. Now, I mean, it's novel, so we would expect the infection rate to ramp up pretty aggressively, faster than what we'd expect to see flu, because typically in flu there's going to be people who have greater immunity to that because it's just, mutate, slightly different. Your immunity from a previous one might work for this. I get that. We're here, it's like, oh, this is really, really different. But again, I'm going to tell you, you'd be stupid to ignore why do such a high percentage of people have absolutely no symptoms whatsoever, completely asymptomatic? Because there is some component of this virus in their immune system that they're able to map quickly and easily, readily, and just get rid of it and kill it. And that is a function of your immune system. It's not rampant. It is kind of rampant, actually. It's not just completely, unknown, right? Random. I guess that's the word I was looking for. It's not random. So that's an important thing to get, is that right now we have some level of immunity in this community already. And then, of course, there's more and more evidence now mounting suggesting it's been circulating since at least early January, maybe even early December, which would be interesting then, right? Puts us way on the front side of this curve. And then, of course, there's some that would say as early as mid-November. And I'm curious about that. I really want to see some more work done on the DNA mapping, which gives us a timeline back to see how many mutations have we seen. So, all right. So back on track with that. So healthcare. So, okay, listen. So if you're concerned that me moving around is going to overwhelm the healthcare system, you do realize that there are hospitals that are laying people off because right now with social distancing and people sheltering in place, there are less emergency room visits in general across the board. So if we just look at the total for all emergency rooms, it's down. If we look at all hospitalizations, it's down. I mean, we're actually taking and we are creating an environment where there is the potential to redeploy people right now. I mean, move people to New York City to work if that's the need. I don't think it is the need, given what I've seen in New York City. I don't think it's the need. I think, again, this media frenzy is feeding you something that you really shouldn't be paying attention to. So, all right, what else? What other reasons can I be insensitive? What other reasons should I not be moving around? Your kids you want to let your kids go out. What about it's your senior, you have a senior. It's not your little kids. You have a senior in high school. If they start high school back up, and they let people start going to school, and you have Grandma Lynn lives in your home too. So now I've got Grandma over here who's 80 years old, and she is at high risk, and she's got all sorts of issues with her lungs. And now schools are back. You've got a senior in high school, and the question becomes, how do I keep my senior from going to school if because Grandma's at risk here, but the senior. So I would say there's a lot of solutions there. The first one I'm going to come back to is what I said before, 10% risk inside the same household. Grandma gets completely distanced. Everything that goes to Grandma is separated. Grandma's food comes out of a different refrigerator. I mean, there are plenty of things that we could do, and honestly, I would say the economy could support those things for those people versus those people having to support them themselves. Because with a full economy working, not full, but working, the potential to divert is incredible. But with no economy working, there is no potential for anyone to fend for themselves in those directions. I mean, there is, but to what extent? Because the fear of, well, how long will it last? I've got enough savings for 6 months. I've got enough savings for 2 years. Is this going to impact me greater than 2 years? Is it going to have a greater impact than that? If we shut it down continually for that long, it would. Now, I know we won't. Our government isn't going to accept that. You know, there's too many people there who realize that this is too detrimental. Suicide numbers going up. I saw on a podcast said that suicide hotline calls have been up. They've gone up 3 times in the last 2 weeks. 3x. The suicide hotline calls are up in the last 2 weeks. Is it true? I don't know. I couldn't verify it. I'm looking. If you guys can verify that stuff, please do. I'd love to see it. So in the end, my point is, and I'll continue to argue to the day that I die, you need people who aren't scared to go into the world and create herd immunity. That's the thing you need more than anything. Because it's a flattening of the curve, it's not a stopping of the curve. The area under the curve is the area under the curve. Until you get herd immunity, there's going to be the issue of continued spread. It will continue to move. So you want this to ramp up. You want to see 3 million cases with it. You just want them to not be the nursing homes. Because right now, I mean, here we are in the greatest lockdown ever, and nursing home cases are running through the roof. Why? Because they're not truly locked down. Because this idea of the whole world sheltering in place doesn't work. Because if I'm so focused on myself and my family and sheltering me, I'm not at all focused on what it takes to shelter grandma at her home. I'm telling you, this is it. And there's literally nothing insensitive at all about people willing to go into the world and connect with other people. It'll help you. It'll help us. You need immunity. It's ridiculous to think otherwise. All right. Thanks, guys.